Abby Howell always had normal mammograms. 2 years ago, something changed, prompting her to have a breast biopsy.
I had atypical cells. It was really confusing to me, and I couldn't figure out exactly what that meant.
When a woman is told she has atypia or given another diagnosis of pre-invasive disease known as ductal carcinoma in situ, these are not the same as a cancer diagnosis.
I think it's a challenging job that the doctors have to try and define what is atypical versus what's normal and what's pre-invasive. We're having a hard time in these middle borderline categories.
Dr. Joanne Elmore from the University of Washington in Seattle and co-authors enlisted 115 volunteer pathologists around the country. The pathologists interpreted a total of 240 test slides containing different samples of breast tissue. Those results were then compared to a standard developed by a group of very experienced expert breast pathologists.
These doctors had almost complete agreement on cases of invasive breast cancer. They were not in as high of levels of agreement when there was atypia present or a ductal carcinoma in situ.
For ductal carcinoma in situ, or DCIS, pathologists agreed in about 4 out of 5 cases, but when interpreting atypical cells or atypia, they only agreed about half of the time. The study appears in JAMA, Journal of the American Medical Association.
Women with these diagnoses are then getting additional treatment, additional surveillance, being told that they are at very high and increased risk for subsequent breast cancer.
The pathologists also disagreed more frequently when interpreting samples from women with denser breast tissue.
Now we know which cases are the most challenging. Now we can study how much improvement we can get by adding in second opinions.
Abby did get a second opinion. She and her doctors opted to monitor her with regular mammograms, which continued to be normal.
For me, I felt like I knew enough that I was willing to take the risk of waiting.
Catherine Dolph, The JAMA Report.